my gender reveal, I woke up and I was wet. And I thought I had urinated on myself. So I'm like, okay, let me just change the sheets. I went to the bathroom to urinate and the baby fell out. And I caught it with my hand. It was a very surreal feeling. I can still feel it on my hand even today.
What? How many weeks were you?
15 weeks and 3 days.
15 weeks.
I easily got pregnant. I mean, at this point, my husband just looked at me and I was pregnant.
Girl, I need something, for me. I'm so sorry for what you've been through because don't know how you found the resilience and the strength to keep on going and to move forward. And it really does show you the power in your words.
Despite of everything I had been through, 6 losses, 5 miscarriages and a stillbirth at that time. In May of 2022, I found out I was pregnant and I made it to 36 weeks. On 12/30/2022, I gave birth to a 4-pound, 15-ounce baby boy.
Oh my gosh, yeah. Welcome to the Nurse on Purpose podcast, where we challenge media stereotypes about nursing and spotlight the incredible and diverse roles nurses play in healthcare. I'm your host, Nello. Every week, I'll be joined by a nurse who is reshaping the narrative. From frontline care to leadership, education, innovation, and beyond. Our aim is to show the world that nursing is so much more than what we see on TV. Together, we'll explore how we can collaborate with media and other stakeholders to create authentic and inspiring portrayals of nurses. Let's begin the conversation and ignite change, one episode at a time. Hi guys, welcome again to the Nurse on Purpose podcast. This is where we challenge media stereotypes about nursing and we celebrate the diverse roles nurses play in healthcare. Today I have with me a very special guest, Rachell Dumas. Rachell is a maternal health advocate, registered nurse, and the founder of A Light After 9, which is a nonprofit that's dedicated to supporting families that are navigating infertility, pregnancy loss, and maternal trauma. After experiencing 9 pregnancy losses, yes, you heard that right, 9, and systemic disparities in maternal health care, Rachell uses her voice to advocate for trauma-informed, equitable care. Through her nonprofit, she provides emotional support, resources, and education to empower families and drive systemic change in the maternal health practices. Rachell, it's such a pleasure to have you on the show today.
Thank you for having me. I'm excited to talk with you.
Thank you so much. Just reading that, 9 pregnancy losses, there is a whole story behind that. And I really just want to dive in and hear your story. Tell us what that is all about, what happened there.
Yeah, absolutely. So I'm a nurse, but I just want to precept this by saying that I was not a maternal health nurse at all when I started my pregnancy journey. So it was a lot of ignorance on my end, just by definition, not knowing or not being educated about what I needed to know in order to advocate for myself. My pregnancy journey started in 2018. I got a positive pregnancy test at home and I went to the OB because I was bleeding. I went fairly soon and they did a vaginal ultrasound and the OB/GYN told me that I was having a miscarriage. So my first known pregnancy ended in a pregnancy loss. I was told by the OB that I was going to have a good pregnancy and everything would be fine. This is just a part of the journey, is what he said. So not knowing, anything else or having any other education, I went on to believe that would be my journey. Like he said, I would just go on to have a baby when I'm ready. So fast forward to 2020, I'm coming back from New York. I was a travel nurse at the time, helping out with the pandemic, and I found out I was pregnant about 2 months after I came back, and I was bleeding again. So I did a pregnancy test. I was bleeding. This time I went to the emergency room, and they did a vaginal ultrasound and said that you're having twins. I don't know what what I was going to do with twins. I'm like, okay. So, with 2018 in the back of my mind, I'm like, okay, but I'm still bleeding. And the doctor reassured me that everything was fine, but it looks like I had what's called a subchorionic hemorrhage, which is when the baby implants into your uterus. And sometimes we get implantation bleeding. but sometimes it causes like a sac of blood, which is typically reabsorbed by the body, and you're going to have a healthy pregnancy. He told me to follow up with the OB, which I did. And by the time I had my OB appointment, my symptoms were just way worse. At 13 weeks and 3 days, I lost the first baby. I follow up with the OB. She says, everything looks good now. My symptoms resolved, so I was feeling confident. And on the day of my gender reveal, I woke up and I was wet. And I thought I had urinated on myself. So I'm like, okay, let me just change the sheets, And about an hour later, everybody had came over, or a couple of hours later, everyone came over, and I went to the bathroom to urinate, and the baby fell out.
What?
The baby just fell out, despite of me being turned away from the ER. Everything was fine. So they said the baby just fell
Listen,
out.
okay, I'm gonna pause there. How many weeks were you?
15 weeks and 3
At
days.
that point, 15 weeks. Wow. And the baby, okay, so for those who aren't healthcare, in the healthcare field listening, a 15-week-old baby is about the size of an apple,
Yeah,
right? Size of a small fruit,
yeah,
which is not huge, but it's also not pea-sized.
yeah.
And you're
It's
kind of nearing like you're a third of the way there.
mm-hmm,
Baby has what? Circulatory, digestive,
mm-hmm.
forming external organs, skin, hair, lanugo, yes, but still in formation. Um,
It very much looks like a baby.
Very much looks like a baby.
Yeah, and I caught it with my hand, and it
Oh
was
gosh.
like it was a very like surreal feeling. I can still feel it on my
Oh
hand even
God.
today.
Oh gosh.
I'm just wailing in the bathroom, and the music was so loud, nobody heard me.
Yeah.
And finally, I gathered myself to bring myself outside to my friends, and I'm just crying, and I'm telling them, the baby is in the toilet. Like,
Oh my
can y'all
gosh.
check and see? Two of my friends are nurses. They're like pediatric nurses. I'm like, can you see? Maybe I'm like losing my mind. Like, I'm losing my mind. Can you just go and check? And one of my friends comes out and he's like, yes, it's a baby. It's a baby in there. And they call my husband at the time. We go to the ER. It's 2020, so he can't even come with me through this experience. He literally has to drop me off. And I go to the doctor, and I've been to this ER numerous times during this pregnancy with issues, right? And they keep sending me away. So I
Yeah.
tell the doctor, 15 weeks and 3 days, I just lost this baby. It fell in the toilet. I'm in shock. I'm crying. And the doctor asked me, how do you even know you were pregnant?
I'm sorry, what?
Exactly.
Hadn't you been there pregnant with the
Right. It's on my chart. I've been here multiple times. I think I would know if I was 15 weeks and 3 days pregnant. Two is 2020. I don't want to be in the ER.
absolutely.
COVID-19 is alive and well, and it's still in its infancy, and we don't know a lot about treatment. I am not about to risk my life after I just did that in New York to be in your ER telling you about a baby that was lost when I don't even know if I was pregnant.
Why
So
did he ask you that?
I don't know
Is
why
she
she asked me
upset?
that. And then I said, do you want to see a picture of the baby? And she said, yes. So I showed her a picture, and she said, oh, that's a baby. I said, oh, yeah, that's a baby. That's the one I was telling
That's what I was telling you.
you, you know. So that is when I, one,
Mhm.
lost hope in the healthcare system, if I ever had it. And then two, I knew something was really wrong with me. It was nothing like that doctor had said it would be. I'm like, okay, something's really wrong. I
Yeah.
just lost 3 babies at this point, total.
Yes. Yeah.
So I followed up with the OB. She diagnoses me with cervical insufficiency. The cure, the treatment is to get a cervical supply
Cerclage. Yeah.
at 13 weeks of pregnancy. That's what she told me. The issue is I had multiple early miscarriages after that. So there was also something wrong other than the cervical insufficiency, right? I'm having early miscarriages that has nothing to do with that diagnosis. And yet I still was not told or referred to a specialist. It wasn't until my manager at the time was like, you need to see a reproductive endocrinologist and a reproductive geneticist to see what's going on. So I went to the geneticist and he did testing and there was no genetic component to the miscarriages and losses. And then I went to a reproductive endocrinologist and that was a restoration of faith that I had, because she had a very thorough plan of care. We were going to check your uterus, the shape, anatomic abnormalities were going to be evaluated, see if there is underlying inflammation causing it. We're checking for autoimmune diseases. We're checking for thyroid issues. All these tests that I could have completed before even seeing her.
Yeah.
And I also question why after 5 losses was I just now seeing a specialist. And it wasn't even my doctors telling me about these specialists. It was my job. I also was talking to a friend about everything that was happening, and her sister owns she's a nurse practitioner, and her sister owns a OB clinic. And she
Yeah.
brought me in, and she's like, you need to be on progesterone suppository once you get your first positive pregnancy test. Check early, start it early so we can make it to 13 weeks. So your cervix can be strengthened. So we
So
can make it
that's
to 13 weeks.
so that's the purpose of the progesterone
Yes.
suppository.
Mm-hmm.
Okay. Is to
To keep the
strengthen.
cervix strong. Yes.
Okay. Okay.
So
Even because the cerclage was did they do this because you weren't even getting to 13 weeks in order to do the cerclage.
well, I got pregnant again. This is my 6th pregnancy. I got pregnant April 2021. I found out, started this suppositories immediately. She gave me a prescription. I filled it, just anticipation, because I easily got pregnant. I mean, at this point, my husband just looked at me and I was pregnant.
Girl, I need some, give me.
I mean, clearly it was
We'll
easy.
talk offline.
Right. I mean, it was just easy for me. He didn't even have to touch me at this point. I was
Right.
like,
Osmotic pregnancy.
right.
I fuse.
Right.
Oh, goodness.
But
Yeah.
I'm glad
So
we
the
could.
NP gave you that prescription.
So she gave me that in
Mhm.
anticipation of being pregnant again.
Yeah.
And I got pregnant April 2021, and I started the suppositories. I was followed by the reproductive endocrinologist still throughout the first trimester, and then I graduated to the maternal fetal medicine doctor who would place the cerclage. Made it to 13 weeks,
Mhm.
and she put in a cerclage, and she's like, come back in 7 weeks. I'm like, I just had 5 pregnancy losses. You really want me to stay away for 7 weeks?
That's
You want me
wild.
to come back at 20 weeks? And she's like, yeah, if, like, you'll be fine. And I said, I love your confidence. I'm not confident that I'm going to. I just had twin pregnancy losses around this time.
Yeah.
I've had 5 total. This is insane. Can I please come back earlier? And she was like, no, if it fails, which it won't, you'll have excruciating pain, bleeding. I'm like, okay. So against my better judgment, I was just like, okay. And I kind of conceded, and I waited the 7 weeks to see her, but I didn't have any symptoms. So I was confident. I felt great. I'm like, okay, well, made it to 20 weeks. This is the longest I've been pregnant.
Yeah.
And I went to the MFM, the maternal fetal medicine doctor's office, and mid ultrasound, the ultrasound tech leaves the room and said the doctor will be back.
Oh,
And
wow.
I immediately knew something was wrong. I don't know what it was because I wasn't feeling nothing, but I knew something was wrong. She comes in, the MFM comes in, who put my cerclage in, and says, your cerclage failed. And I'm like, well, you told me that I would know if my cerclage failed.
Right.
What do you mean my cerclage failed? It couldn't have failed because I don't feel
I
anything.
don't feel anything. Yeah.
There's no bleeding. What are you talking about? She's like, the baby's head is right there. Like, you can go and deliver your baby. And I'm like, when the baby die? And she said, yes. At 20 weeks, yes. So I refuse to take that as the next step. I'm begging her, can we do another cerclage? Can I be on bed rest? Can we do anything to help with this? And she's like, no.
Wow. Nonchalant.
Very nonchalant. Very
Oh, my
nonchalant. As if
goodness.
we weren't talking about a whole life here. Very
Oh,
nonchalant.
gosh.
So I leave that office in rage. I was upset. I had to calm myself down.
Mhm.
And when I did, I called everybody I knew, every coworker, nurse, doctor, tech, anybody in healthcare that I knew, all of my friends, everybody. I said, this is a situation. I've done research. I see that you can put a trans-abdominal cerclage above a vaginal when a vaginal
Uh-huh.
fails to try to save this pregnancy. We need a doctor who would put in a trans-abdominal cerclage at 20 weeks of pregnancy. Can we all look for that? Everybody was looking. We found a doctor named Dr. Fogwell at Texas Health. And I would say his name because it's in a very positive light.
Yeah.
I won't disclose the names of the other doctors, but
Mhm.
he called me on his cell phone and he said, "Send me all your records. I need you to fly down here." And I am terrified that I'm going to give birth on a plane. And she said the baby was right there. I mean, he was like, "Our best bet is for you to fly and not drive. The drive from Atlanta to Dallas is too long, and time is of the essence." So I took American Airlines, and I was in a wheelchair and tried to sit at every time that I could, and I made it to Dallas. And they literally rolled out the red carpet when I got there to the hospital. I mean, from security to check-in, it was seamless. I've never seen anything like it. Everybody was caring. Everybody knew who I was. Everybody knew I was coming. It was prepped. Medications was ready. OR was ready. It just was. I've never seen it. Yeah, I never had an experience like that. I immediately felt safe in the midst of tragedy, um, and trauma. But he came, we went to the OR, and that 3 hour surgery took 8 hours. And when I came out, I was still pregnant. I was like fighting through anesthesia, like, "Am I pregnant? Like, what's going on?" And I was surrounded by healthcare providers just cheering us on. "We're pregnant. We made it." He's like at my bedside every step of the way. And unfortunately, once the anesthesia wore off, the contractions started. And they gave me every medicine possible. He was at my bedside at 1 a.m., 3 a.m. I mean, I don't expect that from any doctor to do that. But he was so accessible, and he was on my beck and call. And the end of a 30-hour labor, my water broke, and I had to go back to the OR, get both cerclages out. I got an epidural and had to deliver at 21 weeks. So he also told me that if that was to happen, that he would bring me back, no charge. I wouldn't pay for anything, and complete that transabdominal cerclage outside of pregnancy, and that I would become a mom. And I believe him. Despite of everything I had been through, 6 losses, 5 miscarriages and a stillbirth at that time, he stayed true to his word. Brought me back out that November of 21. Did the procedure. Also checked my uterus. Made sure everything was fine. And I had some early miscarriages, but in May of 2022, I found out I was pregnant, followed by the reproductive endocrinologist, graduated to a different maternal fetal medicine doctor, and I made it to 36 weeks. And on 12/30/2022, I gave birth to a 4 pound, 15 ounce baby boy.
Oh my gosh. Yeah, this.
I can see your heart rate up.
Listen, my heart is like beating out of my chest.
I can see the
Like
stress.
that. My sweat, my sweat glands are like, stop! Don't put out your makeup. My goodness, Rachell. I think that anyone who's listening is probably like holding your breath right now. To have gone through such a journey, you've been a mom. Like, let's just, first of all, let's just acknowledge that. And
Yes.
I'm so sorry for what you've been through because I don't know how you found the resilience and the strength to keep on going and to move forward. And
Mm-hmm.
it really does show you the power in your words and how you treat people. Like the interpersonal side of healthcare is so
Yes.
important.
Yes.
The words that these other providers were saying to you, oh, just go deliver the baby, or how do you know you're pregnant? It may seem like such a small thing, and they may have said it in passing in a moment of tiredness, frustration, the job is
Yes.
stressing them out.
Yep.
But it's become a part of your story. Like you're
Right.
never going to be able to tell your story without making a mention of those things.
Yes.
So that's why it's so important. And then also Dr. Fogworth, who became like an angel for you. You see the kind of this difference between those two interactions. It
Right.
makes such a huge difference how we relate with people. You don't know what they've been through, whether or not they've been through anything, your interaction with them will stick with them, right? They'll
Mhm.
remember how you made them feel. They may not remember what you did or what you said, whatever that saying is, but people will remember how they made you feel. I'm so sorry for your losses, and I am really grateful that you did have this new baby, who I guess is a toddler now.
He is. He is a pot belly 2-year-old who barely speaks English and is
You
very
better not call him a pot belly because
he's
Auntie going to come for you.
he's so pot belly. He's so cute. Yes. Why do you have a pot belly and yelling at me? Like, I can't take you as seriously as you want me to. So he's so
Yeah,
cute.
I'm so glad. And I know that even now you're in the process of recovering physically, mentally, emotionally, and all of that. But you've taken what was supposed to be tragedies that would have taken you all the way out. And then you've turned that into this beautiful nonprofit where you're supporting families. Can you talk to us more about A Light After Nine, your mission, and what you're currently
Yeah.
doing?
So I call it a light after nine because I felt like for two reasons I finally reached the light after my
Mm,
pregnancy losses. One, I got my baby, my live baby. Fortunately, I have 10, but he is the one that survived the journey. And then two, a light is just being on the other side of this journey because it was physically, mentally, emotionally, spiritually
yes,
exhausting,
everything. Financially, too.
financially exhausting. Oh yeah. I always tell people I could probably afford like a Bugatti with my my bill in the hospital,
Girl,
but
they keep coming too.
they
Those
do. They do.
bills.
They're like, oh yeah, I forgot 3 years ago you had this gauze for $1,000.
And
You
it's
know.
just like a constant reminder too,
Yes.
because it's not like you carry the reward, but you keep on, having to pay and come out of all of these losses,
A lot of
these.
losses, and then he was a NICU baby, so he has his own set of bills in addition to birth. So it's a lot, and I recognize that so many other birthers in their villages go through this. Maybe not the amount. I hope
Yes.
not the amount. I feel like I had enough loss for everybody, but loss is still alive and well. Preterm birth is, maternal health disparities are, and racial inequalities, inequities in healthcare is alive and well. And because of that, we need a lot of resources going through our pregnancy journey, whether it's maternal mental health resources, grants, because this is very expensive. And a lot of people know about IVF grants, but there are grants to help you with pregnancy loss and
Wow.
difficult pregnancies and things like that. And also how to advocate for yourself. There were a lot of times where I couldn't advocate for myself despite of being a healthcare professional because I just didn't know what I didn't know, such as what a maternal fetal medicine doctor was,
A reproductive
a
endocrinologist, like
reproductive
who out there
endocrinologist.
knows that those exist, right?
I didn't know a reproductive geneticist exists. I only
Exactly.
found one in Atlanta, and thankfully he was able to see me. We don't know about these things. I didn't know that until I talked to Dr. Fogwell that I could have gotten a transabdominal cerclage early on, and I would have never had to have that removed at the end of a pregnancy. It would have been permanent. Nobody would have to touch me. It's a lot of things that I wish I had known that I don't want other birthers moms to say they wish they had known if we
Yeah.
can get the education early on.
Yeah.
And because we go into pregnancy thinking that we're going to get pregnant, gain some weight, crave some pickles and get some ultrasounds and then go deliver, we
Yeah.
don't often think about the what if that journey is not as cookie cutter as I think it is.
Right.
What if I need like a cardiologist, a hematologist, neonatologist? What if I need all these? What should I know? What education do I need to advocate for myself and my baby and my family? So we make sure we give you that education, talk to you to see where you are. We also, like I said, do the grants. We have a mom to mom mentorship, a mentorship program. We vet doctors and we deliver doctors to our patients just to make sure they have a high quality care. And sometimes, those reviews can be a lifeline for us. So I didn't know that the maternal fetal medicine doctor that did my first cerclage that told me to just deliver, that was one of her first cerclages.
Oh.
And I am a fan of education in healthcare. Trust me, like I am. However, if I would have read the reviews and also went with a more seasoned maternal fetal medicine doctor, I felt like the outcome could have been different.
Yeah.
So we don't just watch out for those things, especially having 5 losses.
Yeah.
I wouldn't be a learning experience for somebody. But yeah, that's what we do, and we just make sure that our birthers are going through the journey educated, able to advocate, and have the resources that they need.
It's so empowering to be doing such work because you are a nurse.
Yeah.
And although, yes, your background is in trauma care, but, there was such a gap of knowledge
Yes.
because you didn't have, I mean, you were never in the maternal unit, you didn't know all these things. But even
Right.
though you were a nurse, can you imagine how much more confusing this journey would be for somebody that has zero healthcare background? And that's,
100%. I
yeah,
can definitely imagine that. I think about that all the time, that
yeah,
I struggled to navigate the healthcare system that I work in.
work, yeah.
Imagine if you have no. Well, I see it. I see it all the time. When I talk to my moms and birthers and family members and friends who tell me about different issues, I guide them. No, go back. No, switch doctors. No,
Yeah,
ask about this treatment. No,
yes.
do not leave the office. Go
Fight
to
for
the
yourself.
ER.
Yeah,
Yeah. So I give those tidbits all the time because I
yeah,
see it. They
yeah.
cannot effectively navigate. Their lives are at risk when they try to navigate on their own a lot
Yeah.
of times.
Because even as a healthcare provider, you had intuitive concern
Yeah.
for that 7 weeks. You were like, that there's something wrong with that. I don't know
Right.
why, but it just seems way too long.
Right.
Somebody else wouldn't have known that. They would have been like, all right, good, 7 weeks. Well, book me and let's go,
Yeah.
right?
Because my doctor
Um,
told me to.
yeah, exactly. They know their stuff. Wouldn't I believe that? And then do you feel like there was any accountability taken for kind of that dismissal of the concerns that you were having? Did you ever like talk to those providers again or
So I didn't talk to that provider. I actually avoided her like the plague, because I couldn't look at
yeah,
her and
right.
I think about just everything that my baby was cremated. You know, just everything that happened following her actions and her words. I did talk to the CNO, the vice president of patient care at the hospital, the director of women's and infant health at the hospital. Last week I had that, and I'm working with them to help their maternal health program. In that regard, there is some reprieve. However, direct repercussions for her, no, there
Yeah.
wasn't. I did report it to Joint Commission because not only was her way of handling that pretty bad, there were other issues throughout my
Mhm.
journey. Like during my last pregnancy, I went to the ER because I had a heart rate in the 180s anytime I was vertical. I was desatting to the 80s. I went to the ER multiple times for this, but my cardiologist this particular time was like, just go to the ER because I went to the OB. She referred me to the cardiologist after I asked and
Yeah.
advocated because of these symptoms that were just progressively getting worse in my third
Mhm.
trimester, the
Mhm.
tachycardia and the desaturation
Yeah.
and the shortness of breath and the dizziness. And I asked to see a cardiologist. She referred me. Another issue is like, why didn't you refer me? Why did I have to ask for that? Another patient wouldn't be like, can I see a cardiologist, please? But I
Mhm.
did. And he put me on metoprolol thinking that the shortness of breath and everything was caused by the high heart rate. And it was caused by by the baby's position. But the symptoms were getting worse. So I went to the ER this time on his accord. He sent me there.
Yeah.
And I was being ping pong between the maternity triage and the ER. Like I literally went between those two units 3 times until I demanded, after an 8-hour wait, mind you. And I
Wow.
demanded that I be seen in the ER.
Mhm.
Maternity triage said this is an adult health issue. You have the treatment. Treat me. The ER said no. You're pregnant. We are not treating you. So I was in the ER. I was like, please treat me. Do not send me back up there. Do not do that again. I cannot breathe. Like I need help. It's getting worse. I've been here for 8 hours plus. And a doctor in the back had me stand up after I was already vertical, short of breath, dizzy. She had me stand up, hook me up to the machine, and she's like, I want you to see your symptoms. Walk around with this machine. And I did, and my heart rate went to the 180s. It was already up. It just went up further. And then I was desatting. I couldn't breathe. She kept asking me how I feel. I could barely talk to tell her how I felt. She documented that I had no symptoms and that I was fine and sent me back to the maternity triage. There, the charge nurse came out and was like, the ER doctor said you're all fine and good to go. We could just discharge you. And I said, bring me in the back, please. This took me up to this machine. She's lying. That didn't happen. I cannot even believe. I almost started crying, but I couldn't breathe. I just couldn't even produce the tears. And I had nothing to eat or drink for 8 hours. I was starving. And I hooked myself up to the machine and I walked around while the OB on call was attending there, watched me. And sure enough, my heart rate went up, oxygen went down, and I had to lay down. I was short of breath. Asked for a pulmonology consult. Pulmonology came in and said I needed oxygen because if my oxygen was sustained in the 80s, I would have to deliver within 10 minutes. I live in Atlanta. I don't know who can get anywhere in 10 minutes. I can't make it to the mailbox from my
That's
house.
one thing I don't like about Atlanta.
Yeah,
Is the
it's
traffic.
bad. It's bad. But to be at the hospital on a table to get a C-section in 10 minutes, you can't even do that while you're in the hospital. I was like,
Right,
you can't even bring me there right now in 10 minutes and cut me right now. That would never happen.
right.
So this oxygen was a lifeline. I was discharged told that I would get oxygen, never received it. I asked the cardiologist, the pulmonologist, my hematologist, because I was getting iron infusions, the OB, the MFM. I asked everybody, and nobody could give me oxygen. And I had to deliver early because of this. I reported them to JCO, to Joint Commission. So, and then we wonder why Marcia Dines gave Georgia a F, which is worse than the D that the
Yeah.
United States got for preterm birth.
It's crazy how such a powerhouse nation
Yeah.
still has,
Still
the worst,
issues.
one of the worst maternal health complications, maternal health issues for Black women.
Oh, yes.
What do you think contributes to this? Is it systemic racism? I'm not even going to politicize this, but what do you think is contributing to this?
I think a lot is contributing. It's a laundry list. Systemic racism, implicit bias, maternal health care deserts. Why wasn't I able to find a surgeon in Atlanta to put in a transabdominal cerclage? Why did I fly to Texas with a baby coming out of me? That should never happen. I live in Atlanta. I don't live in a small rural area. I live in the city. A lot of times when I did have issues where I had to keep going to the ER, keep going to my OB, there was just no one listening to me. And then, furthermore, there was gaslighting, telling me that my symptoms were my symptoms and that everything was fine. So, medical gaslighting is a huge issue. We
Yeah,
can treat patients differently and more effectively if we simply just listen to them.
exactly. Yeah.
So, it's a
And
lot.
believe them.
And believe them. And believe them. You're right.
Yeah,
That's such a huge component. It's not just
yeah,
the listening and the active listening, it's the believing.
yeah, for sure. I did like that you mentioned the services that you provide. And one of them that stood out to me was the mom to mom mentorship. Can you tell me more about that?
Yeah, so I always encourage everyone, even preconception, to get counseling and talk to a therapist, especially marriage counseling, because you don't know how it's going to impact your relationship. But
Mm,
definitely individual counseling, because as the gestational carrier, the birther, the mom, you carry a different type of weight mentally.
yes.
And having a therapist is just another level of self care that I can't even comprehend. I wouldn't have been here if I didn't have my therapist that I still see every week. And while all that is great to have, it's so different to have someone with a lived experience help you along your pregnancy journey where you don't see your light at the end and you don't
Yeah.
think that you're going to have your baby, or it's super difficult and you get weary on that journey. So to have somebody who's been there, done that, hold your hand so you can reach your light, it's such a different type of experience. So
Mhm.
that's why I started the mom to mom mentorship program, and that's what we are. So if you're a mom who needs the hand holding and would like it and assistance from another mom who's been there, done that, and or if you're a mom who's been there, done that like myself and would love to help another, that's the perfect program.
So wonderful. You have done so much research. I'm sure that you're
Yeah.
like now you're a maternal fetal expert,
Right.
even though that wasn't your background because of all the reading and all the researching and what you've been
Live
through.
experience. Yeah.
You had to do a lot of that for yourself and even to provide those resources on your website, which I think is just amazing, just to look on your website and see all the things that you have, been able to put together for moms and for families really to support them. That's truly what it means to walk in your purpose. Do you feel like you're walking in your purpose?
Yeah, now more than anything. I felt like when I was a trauma nurse, I was saving lives, and I felt like that was purposeful. And then when I started my other business after COVID to help other smaller healthcare entities keep up with the recommendations from World Health Organization and CDC and DPH, I felt really good. I felt like that was a need that I was feeling. But this time it's so much more personal. And the way that it's been so receptive amongst not only the healthcare community, but other moms has just been phenomenal. And that's how I know, like, this was for a reason. And when you're
Yeah.
going through it, you really don't understand that. You're like, man, God, the universe, whatever you believe in, they clearly hate me. I don't know what I did in the past
What I
life.
do.
I don't know what happened, what I did, but here's my payback, and I don't understand why. And it's not until you're on the other side, like I am, to see, oh, this was for a bigger purpose. It's
Yes.
bigger than giving birth because a lot of people give birth, um,
Yeah.
and it's okay. It's bigger than that. It's to show all these other moms and birthers and other people struggling that there is a other side and you do have help. And it's also to show healthcare providers how important it is to address their biases and to give good care and to give safe care.
Yeah.
And it's also to show lawmakers and policymakers that we need to change a lot, a lot,
Yeah.
to say the least.
Absolutely.
But changes need to be made to
Yeah.
support moms in their journeys.
What message would you share with women who are currently experiencing the pain of loss, miscarriage, or just struggling with pregnancy challenges? What can you share with them just to give them hope? And
So while you're on that journey, it's very dark. You don't know what's next. There's a lot of unknown and uncertainty, and it can easily just worsen the darkness. Reach out and get the resources that you need. And I know it's so difficult to do that while you're going through it,
yeah,
but it'll make your journey a little brighter.
yeah,
I'm not saying it's going to solve all your needs, but it can make your journey a little brighter and a little easier to have those resources and the support to get the education so you can advocate for yourself. Do not go through that alone. And for the partners, you too, get the mental health resources that you need
yeah,
to help your significant other because you can't pour out of an empty cup either. And also, it's very difficult to stay positive throughout this journey, but it makes a big difference in your health. And then, last thing I want to say, if you are advocating for yourself and you're not seeing the results or you know something is wrong and it's not being addressed, do not be afraid to switch providers. Trust me, I know switching all your medical documentations at any point in your pregnancy is exhausting. But sometimes our life depends on it, and the life of our babies
yeah.
depend on it. So do not be afraid to get at least a second opinion or to completely switch your providers.
That's wonderful. If anyone out there is maybe looking to also be a maternal health advocate, just like you have, where can they get started? Let's say, for instance, they just need some advice, guidance, and where can they, how can they get started on their own journey to support moms, just like you're doing?
Yeah, so you don't have to start a nonprofit and start from scratch. There are so many maternal health organizations out here who are doing the work and need extra hands and boots on the ground, such as A Light After Nine, such as Healthy Mothers, Healthy Babies, March of Nines, PSI. So many organizations are out here that you can do your research and join, help with volunteering efforts, call, email, DM, share their information. It's so many ways. Connecting on social media. So it doesn't take much to be an advocate. I think there's more of just a fear of retaliation that may hold people back. But once you're overcoming that, just reach out and see how you can help. We're more than receptive of having extra hands.
Yeah, I know the work is large. The vision is large.
The
And for
visions.
sure, the work will take a great team of people to accomplish.
Yes.
I understand that firsthand. I know you need all the support you can get.
Yes.
So if anybody is also interested in this kind of work, I'm going to leave all your information in the show notes, or
Thank you
you
so
can
much.
visit A Light After Nine
.org.
and just look through all the services that you provide. And if maybe you're not looking to get into maternal health advocacy, but you need support, you
Mhm.
need, like you said, just even informal support like the mom to mom mentorship, or if you need more formal support, like the grants, you need funding, you can, go to that website, alightafter9.org, and let Rachell be there for you. Let her support you. Let her and her team walk you through your journey. Maternal journey is not an easy one. I think a lot of people forget how, especially even moms like me, sometimes I forget like what I went through. But when you're going through it, it really does take over your entire mental space.
Yeah.
So to have that support is really crucial. So I really applaud you and I appreciate you.
Thank you so much.
We're going to switch gears for just the last 5 minutes because I want us to talk more about, a little bit about the media portrayals of nurses. And just give me your opinions. Have you seen shows? What are your thoughts about how nurses are portrayed? And just talk to me about it.
I avoid those shows. I know people were so like, oh my God, Grey's Anatomy, which I did watch like one or two, and I was like, oh, I'm impressed by the symptoms and the management. But it's just like, they acted like nurses barely existed on Grey's Anatomy. Like, there were times like when a bunch of doctors were like rolling stretcher down the hall and no nurses could be found. And it just was a lot of moments where nurses, where we would be at, and we were to be found. And I'm just like,
missing.
Yeah, and I worked at a big teaching hospital, multiple teaching hospitals. And even though, like, the doctors are learning, even in July when they come, it's still nurses everywhere. And that bothered me. Or nurses are portrayed as very sexy. And I never thought of my profession as sexy at all. I don't see anything about
Nothing sexy about blood.
Right, it's like nothing about it is sexy. And from a TV standpoint, how we're portrayed in the media after COVID, nurses seem to be praised more. There were periods in time though where we were demonized for certain things happening, but after COVID or during COVID, I felt like there were times where we were put on a pedestal that we rightfully should have been, because we were the the healthcare providers who were at the bedside risking our lives, but so was RT and other doctors and all those things. But we were at the bedside more than anybody else, and we were doing just a god awful lot of work beyond the call of duty every day. And I do at times really admire how we're portrayed, but nothing or no one or no outlet can truly capture everything that we do. To be honest, it just isn't possible, because that varies on a day to day. And it's just different. It's nothing like being a nurse. We love it. Sometimes we hate it, but we truly save lives.
Yes, we do. I think that's the part of it that we love. It's that we feel that gratification for all the work and all the labor of love. We see that the patients getting better, their lives are improving, and that's the love. I think it's 85% love. The rest of it is just burnout.
Right. Burnout.
We are not wanting to be sexy, please, ma'am. Stop. Thank you. So we're gonna wrap up by playing our game, and quickly I'll tell you about the game. So you are going to write your own show based on a genre that I will shake around and pick out from this jar.
Okay.
This show or movie or children's, it could be anything. It should feature a nurse or a nurse lead. Okay? Are you ready?
I'm ready.
Let's do it. Put that thinking cap on.
Oh, goodness.
Let's go down. Okay, Rachell. Oh, okay. So your category is international film.
International film.
So not American, because I guess that's where we are, but something international. I don't even think it matters at this point, because international film is also a film, right?
Still a film, but I would love to see a movie or a documentary, rather. A show, a documentary though, of the differences in nurse work compared to the United States, whether it be like all over the world, because that varies significantly. I've seen and I wanted to start from nursing school to becoming a nurse and what that looks like. Because it varies so much, and I just want to see like how does that impact patient outcomes, like they're set up in healthcare. I went to Bali over the summer last year, and was talking to this doctor, and I don't even know how I always connect with the healthcare provider near me. We don't even like,
Yeah,
I
they
don't even know what
recognize
it
your
is. Like, we're
mission.
always attracted to each other. And he's like, yeah, I'm a hypertension doctor. He was from, I want to say Norway or something. I forgot where he was from. But they
Mm,
are doctors based on disease
mm,
processes. So
interesting.
there's like a diabetes doctor, and you could get multiple certifications. So if you want to be a diabetes and a hypertension doctor, you can be both. We were like doing the bachata in the line at the airport.
So
But
it's not like being an endocrinologist, it's
no,
a
so
specialization in diabetes management.
diabetes management,
Got it.
hypertension management,
Mm,
thyroid, diseases.
yeah.
So I thought it was very interesting.
Yeah, that, I mean, I have seen that because I know that there will be some physicians, for instance, rheumatologists, that will practice, but their entire clinic is focused on lupus,
Yes,
right? Even though they have that overarching rheumatology,
right, right.
certification,
But
but
he
still.
wasn't a PCP or internal medicine or cardiologist. He was just a hypertension
Hmm,
doctor. So, because we know there's like MS clinics, lupus,
right, right,
those
right.
big,
Yeah,
oncology, there's
yeah,
whole
exactly.
oncology centers.
Interesting.
But yeah, I just thought it was very interesting. I wish I could remember where he was from, but
Yeah, how healthcare is practiced in other parts of the world with
yeah,
a
and
focus
healthcare
on,
outcomes, like
yeah,
how it impacts their outcomes. Is it better? Is it worse? Does it
yeah.
make a
I
difference?
love that. That's such a great one.
Yeah,
That could be, yeah, that'll be so cool. That, I love that concept, just looking at different countries, developing, whatever, just all throughout the spectrum, and
yeah,
seeing how nursing is portrayed, how they are guarded. Because I
mm-hmm,
come from Nigeria, so I already have that perspective.
mm-hmm.
So my perspectives are Nigeria and America. Those are my two perspectives, but it would really be great to see. I had a nurse who I was talking to, he's Nigerian, but he did his PhD in Hong Kong. So he
Okay,
has that like Chinese perspective of nursing. And I was like, that's so interesting. So I'm going to be talking to him soon. But anyway, love
yeah.
that. That was
That is
awesome.
very interesting because they practice medicine in general differently.
Yeah.
But this doctor was from Poland. He was Polish.
It was
Um,
Poland.
I remember
Okay.
because we were talking about sausage, Polish sausage. So yes, he was from Poland. But yes,
Okay. Rachel, where can folks find you if they want to connect with you?
yeah, you can go to www.alightafter9.org. You can call us or email us at info@alightafter9.org. We're on social media. We're not on Twitter, but we are on Threads and Instagram at alightafter9. We're also on LinkedIn, so if you want to professionally connect, you can just find me, Rachell Dumas, RN.
And so I just want to read off from your website some of the services that you provide again, because I want people to be really aware. Is that you provide emotional support and peer-to-peer mentorship. You provide advocacy, education, and community outreach. So mean
Mhm.
that you can actually educate hospitals and
Yeah,
healthcare systems
we
on
do.
improving their maternal health,
We do.
right?
We do
Very
partner with
key.
hospitals and help
Absolutely.
even clinics with their
Yes.
maternal health programs.
Right. Community outreach is one on one. So you're starting small scale to very large scale.
Yes.
Wonderful. You do offer doctors and mental health resource referrals. So if people are confused as to who do I pick, who's good for me, these are services that you can share and provide for them.
Absolutely.
You do provide grant resources and funding. So information about where they can get some money to cover some of their very heavy expenses. And then you offer preconception, pregnancy, postpartum, and loss support. That preconception stage is so key.
It's okay.
Yeah, a lot of people don't really know how to plan to have a baby, especially when you're advanced in age. Like if you're in your 30s, they
Yeah.
don't know, oh, monitor your LH or how to check their ovulation, how to plan intercourse. They don't know that.
Right.
So that support is very important. And then you also offer maternal palliative care and care management. Wonderful resources that you offer here. You're doing amazing
Thank you.
work. And I know that the name is a light after nine, referring to that light at the end of the tunnel and the fact that you did have your baby boy. But I do want to say that you are a light. You are a light.
Thank you.
really a light after 9 in pointing people to hope. Again, people who have lost hope, people who are feeling frustrated with the healthcare system, who feel like there is just disparity in their way their treatment is approached, and you're giving them hope. So I just want to celebrate you for that. And
Thank you so
yeah, yeah, you're welcome. You weren't comfortable to sit on the sidelines and say, "Hey, it's okay. I just want to recover and be over it." No, you strapped on your boots and you said, "I'm going to fight for so that not one other person has to go through this."
yeah.
And just turning your trials into someone else's triumph. It's a worthy journey, and I'm so proud of you. So
Thank you so much.
yeah, it's such a pleasure to have you here today. Thank you for stopping by. Guys, I hope you have gained some valuable lessons from Rachell and really learned from her story. And I hope that you guys will continue to like, continue to share, continue to subscribe. And I will see you all in the next one. Bye bye. Thanks for hanging with me till the end. I hope you gained some valuable insight into the world of nursing. If today's episode inspired you, please like, subscribe, and share with someone who needs to hear about the amazing work nurses are doing. Let's keep breaking stereotypes and reshaping the narrative together. I'll see you next time.